Hi, I'm Claire and I'm a pelvic health physiotherapist, and I want to talk you through some initial recovery tips after caesarean. But first of all, I want to show you what goes on during a caesarean so you understand a little bit more about your body. So first of all, they go through a layer of skin and then through the layer of fat before they come to the connective tissue called fascia. Then they come to your tummy muscles and they go between your tummy muscles. For most women, there's no cutting of their muscles. Then we come to the peritoneum and go between, and this is the sac that holds our organs. Before we come to the bladder and the uterus, they move the bladder out of the way, come through the uterus where there's amniotic fluid, and we find your baby. So I think you can see that there is a lot going on in your body, and this is why you experience pain and swelling. And that's why taking your painkillers is really, really important to try and stay on top of the pain. Once you get home, you can try using some ice packs and placing them gently over your scar just for 5 to 10 minutes every few hours, and this can also help manage inflammation. One of the biggest things that women struggle with is getting in and out of bed. And I want to let you know that actually gentle movement in the early days is absolutely fine and actually good for you. Gentle movement actually helps to manage swelling. But to get in and out of bed, what I recommend for you is that you roll onto your side initially. So you take your arm, take it over and hold onto the side of the bed, bend your knees up and let them go over and roll onto your side. Once you're on your side, let your feet off, and if you want someone to help you, they can take your legs, slowly lower them, and as your legs go down, push with your arms and you'll come into a sitting position. Do the reverse of this to get back into bed. It's completely normal when you're in pain and you've had surgery to want someone to almost lift you out of bed, but I often recommend against this because actually once someone comes into your personal space and is almost pulling on you, you can actually get a little bit more tension as you kind of pull the other way, and it gives you more pain. So the more that you can do yourself with a little bit of help, the better. The other thing that women often struggle with is actually if they're coughing or laughing, having a little bit of discomfort in their scar. So what I recommend is you do something called a supported cough. So you either have a little towel or a blanket over your tummy, or use both of your hands just to support the scar as you cough, sneeze or laugh. A little bit of pressure, less movement of your scar and less pain. I want to let you know that pelvic floor exercises are really important for you as well. It's natural to think when you've had a caesarean that you don't need to do them, but pregnancy also really impacts our pelvic floor, so it's relevant for all of us. You can start doing them once you've done your first wee. I totally appreciate it may not be top of your list, but when you're ready, get going on them.